Hey everyone, my name's Lilly. I was the Glaucoma Fellow at UT Houston last year. Just here to tell you a little bit about the program. I think as you enter the interview trail for fellowship, you'll realize that the UT Houston program is fairly unique. Although it's an academic center, it doesn't operate quite like the other academic programs do. It's a really good clinical experience. It's very clinically heavy. You'll spend about 70% of your time at the Cystic Eye Center seeing private patients, the other 30% of the time helping residents at LBJ, which is the county clinic. The acuity overall is really high. A lot of the patients you're seeing were referred in from other glaucoma specialists and doctors in the community, with cases that are not always run-of-the-mill. So your surgery experience is just very different. You're going to get a lot of acute referrals and do cases that don't really fall into any category necessarily in your case logs for ACGME. But it's a great year to build your clinical knowledge and your surgical skills and learn to think outside the box. I thought it was a really great complement to my residency experience, and it filled in a lot of knowledge and surgical gaps that I thought I was lacking. It's a very trab-heavy program, which is great. Not only do you do a lot of primary trab surgeries, but you're also managing all the post-ops in the clinic, as well as doing a bunch of minor procedures and needlings on trabs that were done years and years ago. So you get really comfortable in that aspect. There's a good amount of complex cataract surgery built in, a lot of Migs opportunities as well. The nice thing about operating at Cystic and the private surgery center is that you can access most Migs devices, even newer ones coming out. So if you want to get your hands on and play around with a certain device or technique, you can, which is excellent. And I think one other really great thing about the program is you are busy. You're busy in clinic. You have a high surgical load, but you're not spending a lot of time doing non-glaucoma learning. So there's really no expectation to do a bunch of scut work after clinic, like prior auths or anything like that. You're not expected to take a trauma attending call, so when you're called in on call, it really is for very glaucoma-specific problems. And it really lets you dedicate your year to learning what you came to learn, and we're not spending a lot of time doing a lot of fillers. I think Dr. Feldman says it very well when you do your interview with him. It is an apprenticeship, not so much a fellowship, so you're really focused on things that you want to take away from the year, which is great. It's nice working with both Dr. Shaw and Dr. Feldman. I think they have different approaches to things, different surgical techniques. So you really get a pretty varied experience as far as what you're going to be exposed to. And the residents in the program are great. They're super, super great on call. They're really good at managing acute things. They're excellent in resident clinic. So it gives you an opportunity to get your hands on teaching at LBJ. Via clinic and in the OR. So if you'd like to sit and staff them for certain cases, you can, which is great if you're expecting to go into an academic career that involves teaching. Overall, I had an awesome year. Houston was a great city to live in. I really enjoyed working with everyone in the program and highly recommend it. Definitely, if you get a chance, at least do the interview so you get a feel of how it's different than other programs maybe you're more used to. And if you have any questions, feel free to email me. Good luck!